I think the first thing for associates to recognize is that the owners truly aren't all about the money. Like the associates, the owners really first and foremost are about the patients. It's just that the owners also have a fiduciary responsibility to the practice and to the associates and to the staff members and to the patients and the clients to generate enough income to be able to continue to provide the level of care that the patients need and the clients demand, and to have the financial resources to be able to give the doctors and the staff members pay increases and pay them fairly and provide a fair and reasonable compensation and benefits package. So while I think team members sometimes believe that the owners are all about the money, they really aren't. They just have this fiduciary responsibility in addition to their responsibility to the patients. So I think from an associate perspective, you first have to recognize that. And then I think the second thing, instead of focusing on how can I grow my revenue, I think it's important to focus on your patients. And if you focus on your patients and what is in the best interest of your patient, the money will follow. So it's all about what is our medical protocol, what components of healthcare do all of my patients need depending on their age demographic, and are all of my patients getting the care that they need? And if they're not, what do we have to do differently to make sure that the patients get that care? Again, to me, if we focus on the patient and the patient drives the medicine and the medicine drives the business, the dollars will follow. So there's a huge untapped potential in many, many practices for additional necessary care. And part of it is just we're busy and we don't take the time to really use the data to tell a story and to help us see or identify where the opportunities are. So pay attention to, again, what's in the best interest of your patient, and work on your communication skills so that you can effectively convey to the client what their patient needs, so the client gets to yes and the pet gets the care that they need. Then your production is going to reflect that. So good for the patient, good for the client relationship, and certainly good for your production and your compensation.